This month, California's Attorney General sued a company called Chrome Holding, a name nobody knows because it used to be called 23andMe, the company that holds the DNA of 10 million people. When it went bankrupt last year, those 10 million people became a line item in an auction. And here's what makes that strange. In the original investor presentation, the founder wrote that 23andMe would never lose sight that behind every data point is a human being. This is the hindsight. To understand how that promise became an auction, you have to go back to 2006 and a founder who believed the most valuable thing in medicine wasn't a drug, it was a database. In 2006, Wojcicki co-founded 23andMe with one belief, that people should have direct access to their own genetic information. Not through a doctor, not through an insurance company. Directly. You mail in a tube of saliva, you get back a map of your DNA, ancestry, health predispositions, inherited traits, carrier status, for $99. By 2021, 10 million people had done exactly that. And what did all those samples add up to? But here's what most people don't focus on. The kit wasn't the product. It was the front door. Every customer who sent in that sample and clicked yes on the consent form became part of something larger, a research community, a database of 10 million people. All of them consented. All of them opted into scientific study. That's not a consumer business. That's a research asset. Why does that distinction matter? Because Wojcicki wasn't just selling ancestry reports. She was building one saliva sample at a time, one of the largest consented genetic databases in the world. And she believed that database was going to change how drugs were discovered. You might be wondering, didn't customers know this? Most did. The consent process was explicit. But what they consented to and what they emotionally understood were not always the same thing. Think about it. Someone who mails in a saliva kit to find out they're 23% Italian is not thinking about contributing to a drug discovery platform. Both descriptions were accurate. Only one is how people actually felt. The word Wojcicki kept coming back to was trust. 23andMe worked because customers trusted the company with something permanent, not a password, not a credit card, their biological identity. That trust was the foundation of everything, and as it turned out, the source of every constraint that followed. In November 2013, the FDA sent 23andMe a warning letter. The company had been marketing health-related genetic reports, disease risk, carrier status, drug response, without going through proper authorization. The agency told them to stop. So, they stopped. Now, what happens to a company when the FDA forces it to strip its core product? Usually, it dies. 23andMe didn't. Instead, they spent the next 4 years doing the one thing that actually mattered, proving the science. Carrier status reports, FDA cleared in 2015. Genetic health risk, 2017. BRCA variant screening, 2018. One authorization at a time, they rebuilt every health feature they'd lost. Was the FDA battle a crisis? Yes, but it was also the thing that made the investor story credible. Every clearance they earned meant any competitor who wanted to offer the same features had to go through the same gate. So, what did 4 years of fighting the FDA actually build? By 2018, 23andMe had FDA-validated health claims that no direct-to-consumer DNA company had matched. That's not just a regulatory badge. That's a moat, and they built it under pressure. Which is what brought GlaxoSmithKline to the table. In July 2018, GSK announced a 4-year collaboration with 23andMe and wrote a $300 million equity check. $300 million. Not for the ancestry kit, for the data. Why would one of the world's largest pharmaceutical companies pay that much for a consumer DNA brand? Because drug discovery has a brutal failure problem. Most clinical trials fail, not because the science is wrong, because the patient population is wrong. The drug works, but not on the people who got it. A consented, FDA-validated database of 10 million people changes that math. GSK was signaling to the entire market. This data is real, and it has a very large number attached to it. By 2021, when 23andMe went public via SPAC at $3.5 billion, the story had been stress-tested at every level. Regulatory credibility, earned under pressure. Commercial validation, $300 million from GSK. Therapeutic pipeline, in development. The founder's summary, in writing, in the investor presentation. Filed with the SEC, publicly accessible. Almost nobody has gone back to look at it. What I'm about to read you is in the public record. If you only remember one thing from this video, remember this line. The company never loses sight that behind every data point is a human being. That line was doing two jobs at once. It told customers, your data is safe with us. It told investors, the trust we've built is our competitive advantage. For 3 years, both groups believed it. The truth is, neither of them was wrong, not yet. And that's the thing that makes this complicated. The line wasn't spin. She'd said versions of it for 15 years. The trust was real, but real and sustainable turn out to be very different problems. By 2023, 23andMe had on paper almost everything a platform company needs. 10 million customers. FDA authorized health reports. A pharmaceutical partner who had written a $300 million check to validate the data. A public market valuation at peak of $3.5 billion. So why was the company losing money faster than it was making it? In fiscal 2023, operating expenses were 153% of revenue. The net loss was 104% of revenue. Why? Because the two businesses Wojcicki was building didn't run at the same speed. Here's the contrast that makes it clear. When Blackstone bought Ancestry in 2020, it paid $4.7 billion. Why? Because Ancestry had 3.6 million subscribers, over $1 billion in annual revenue, not from DNA tests, from genealogy records, family trees, historical archives, repeat customers paying every month. The DNA test was the front door. The subscription layer was the reason to come back. 23andMe had the front door. It never built the reason to come back. But here's the thing. The Ancestry comparison only explains part of the problem. The deeper trap was structural. To maintain consumer trust, the genetic database had to stay human-centered, consent-driven, and protected. No surprises, no sudden monetization moves, no moving fast. To generate the therapeutic and research revenue that would justify the public market valuation, the same database needed to become a commercial engine, powering drug programs, generating licensing revenue. How do you serve both masters from the same dataset? Genetic drug discovery takes decades. A public company's patience runs out in 3 to 5 years. Could not satisfy both. The same data could not satisfy both at the required speed. And here's the part nobody had to say out loud. Wojcicki knew both of these things. She wrote the trust language and the therapeutic pipeline slides in the same document to the same audience. That's not cynicism, that's conviction. She genuinely believed both could coexist, and that belief, not any single decision, is what set the trap. And this is what makes it hard to point at a single mistake. There's no villain, no obvious moment where it went wrong, just two genuine beliefs that couldn't survive in the same company and a market that eventually ran out of patience. On September 17, 2024, all 7 of 23andMe's independent directors resigned on the same day. Their letter said they could no longer support Wojcicki's efforts to take the company private. The proposals, they believed, didn't offer outside shareholders a fair path out. 7 people with fiduciary obligations leaving simultaneously. Why resign rather than simply vote no? Because staying on the board meant accepting legal responsibility for a direction they no longer believed in. That is not a routine disagreement. That is a board saying on the record that the founder has become incompatible with her own company's governance. 2 months later, 23andMe cut 40% of its workforce. Therapeutics discontinued. The drug discovery pipeline that had been the centerpiece of the 2021 investor pitch, gone. And what did that leave? A company with a consumer brand, a genetic database, and no clear path to profitability. In March 2025, Chapter 11. But what made this bankruptcy genuinely different was the asset register. When almost any other company goes bankrupt, creditors fight over cash, IP, and real estate. When 23andMe went bankrupt, the main contested asset was the genetic data of 10 million people. The 2023 data breach had made clear exactly what that meant. Here's the part that often gets misreported. It wasn't 7 million accounts that were hacked. It was 14,000. 14,000 accounts, accessed through credential stuffing. So, how did 14,000 become 7 million? Through DNA relatives. When an attacker gets into your account, they can see the profiles of everyone you've been matched with as a relative. People who made no error. People who never interacted with the attacker's network. Their data was exposed because someone in their genetic family had reused the password. The feature designed to make the product meaningful was the same feature that amplified the breach. And get this, in the bankruptcy auction, Regeneron bid $256 million. Anne Wojcicki, through a nonprofit entity called TTAM Research Institute, bid $305 million and won. The founder, who had been rejected by her own board, paid more than a pharmaceutical company to buy back what she'd built. Which is strange, because usually the story ends at the bankruptcy. The company sells, the mission dissolves, and the founder moves on. Wojcicki didn't move on. She paid $305 million to stay. Anne Wojcicki did not lose control of 23andMe because she was reckless. She lost it because she could not stop being the founder. Every decision that led here came from the same source. The dual promise that couldn't be kept. The take-private fight that drove the board out. The refusal to let a pharmaceutical company define what her mission meant. All of it from the same place, the belief that 23andMe was built around something real, something worth protecting, something that would work if she could just hold on long enough. That belief was also the company's founding strength. It's what made 10 million people trust her with their DNA. I want you to sit with that for a second. The founder's curse isn't arrogance. It's that founders build companies around convictions so foundational they cannot separate themselves from the mission. When the market runs out of patience, they keep fighting, through the board leaving. Even when fighting means writing a $305 million check. The California Attorney General's lawsuit, filed this month against Chrome Holding, is asking Wojcicki to answer for the trust she promised to protect. She fought to stay in control so she could answer that question herself. Whether she can is the story the next few years will tell. If this is the kind of story you come here for, subscribe. There's a new one every week.